They say in Harlan County there are no neutrals there. You'll either be a Union man or a thug for J.H. Blair. Which side are you on, boys? Which side are you on? Tell me, which side are you on, boys? Which side are you on?
Good evening, everyone. We are the Louisville Workers Brigade, an organization dedicated to connecting various working class communities across Louisville, as well as organizations that support these communities. Our goal is to unite the working class regardless of industry, employment status, race, nationality, sexual orientation, etc., in order to make our lives better as working people. We seek to educate, support, and help unite the working class in Louisville and beyond. Though the work is challenging and often slow, we believe this paves the way for us and future generations to live in a world that we want to see. Healthcare and healthcare access are one of the many topics on the minds of everyone, due to recent events regarding the assassination of the UHC CEO Brian Thompson and the national conversations that have sprung forth from this incident. Our broken and corporate-centered system hurts nearly everyone, and we are at a particular moment where people are conscious of this struggle across sometimes infractable political divides. Some people already know they support universal health care, and others know something is wrong, but are not convinced by any alternatives. This is understandable when we have seen government-led programs center on corporate interests that hurt us, our families, and our neighbors, or public programs that are underfunded so drastically that their private counterparts are the only viable alternative. We are here to weave together a more coherent understanding of our system as it is, an understanding of where we want it to be, along with how to get there. The United States is 55th in life expectancy, while still spending double in healthcare per capita than other wealthy nations. We have $200 billion in medical debt nationally, with 14 million people owing $1,000 in medical debt. Every day, working-class Americans regularly put off care due to the price. This leads to detrimental health outcomes in regards to quality of life, ability to work, and provide for yourself and your family, and often leads to untimely death. An estimated 40,000 to 80,000 die yearly due to a lack of insurance alone. Preventative health care is a luxury for the working class, the underinsured, and or the uninsured. Often, the working class finds itself seeking emergency care for what could have been prevented years prior. For-profit health care ultimately requires cuts in services, payout, and a higher monthly bill in order to expand and make profit each year. In this lies the contradiction. We need health care to live, to enjoy our lives, and be in the community together. Our capitalist and corporate system needs us healthy enough to labor and to generate profit for the owning class. But for-profit healthcare will only allow us to achieve a fraction of these things, while being not only destructive towards our own health, but also ultimately towards the smooth running of the system we find ourselves in, whether we like it or not. We can and should dream bigger. Numerous countries spend far less on healthcare and have far better and more equitable results. There are many paths forward, but the most equitable all center on universal healthcare. Affordable, ideally free access for all people that is reliable, accessible, and timely. This is what we are here to discuss, and with that, we would like to introduce Kay Tillow from Kentuckians for Single-Payer Healthcare. She will be speaking today about healthcare and the working class in Kentucky and the broader United States, and what needs to be done to build a better future for ourselves, our families, and our communities.
Thank you, Dalton. I'm delighted to be here with you tonight and to get a chance to talk about my favorite topic, which is national single-payer health care. We're grateful to the Louisville Workers Brigade. They've been very kind to Kentuckians for single-payer health care, and they shared a booth and helped us at the World Fest, and then they shared their booth with us at the Pride event. And so we appreciate the cooperation and the camaraderie between the organizations. Healthcare and the working class is the topic. And to put it briefly, the working class doesn't have enough health care, and it costs too much, and it's not accessible, and there's often impediments in people being able to get approved what their physicians order for them. And on top of that, it's a big barrier to working class struggles because the employer controls the health care. And that is a problem. I know that from my experience as a unionist, that as soon as you go out on strike, they get the letter, at such and such a date, the health care will be cut off. And that, for people, particularly who have sick children with very expensive, diseases and conditions, makes it very hard to wage a strike struggle, fight back against a lockout, etc. So one of the reasons that we need a national single-payer, publicly funded healthcare system is to free healthcare from the grip of the corporation, to allow workers to be free of that power over them. I worked for a couple of decades, longer than some of you have been here, on trying to win the union movement at the base to support national single-payer health care, to get them endorsing this concept. And that went very well. We gained over 600 union organizations. We got every Central Labor Council in Kentucky, all 8 of them. The Kentucky AFL-CIO was the first state federation to endorse it, et cetera. We were doing all of that kind of in the lead up to the Affordable Care Act that happened in 2010. And we were very successful at it. I think, one, we have to say that most working people are in support of it. What we were not successful at is getting the top leadership they said they were for it, but they wouldn't really stand with it when faced with the power of the industry, the profit-making industry. So there is much more work to be done. The battle shall continue. But it's important for people to understand why we can't just make a tweak here and a tweak there and somehow the Affordable Care Act will be okay. We have to move to a system that is publicly funded and where the coverage is automatic, and so that everybody is covered, and we remove the barriers. All of those things like co-pays and deductibles, all of that you have to pay, that's the insurance industry's ideology that they've imposed on our healthcare system because they don't want people using it. So if you make it expensive, people don't use it. So we have to work to get a Medicare for all, an improved Medicare for all. Medicare's not good enough. Now that's the program that covers seniors and people who are permanently and totally disabled. And Medicaid is the state and federal program that covers people with low income and with other disabilities. I think it's easiest to explain why we have to go to single payer is that we have to remove the profit from the system. That is the problem. That is the problem with it. When the healthcare is controlled by a profit-making system, it doesn't work to give care. It works in the interest of those who are trying to make money. And I always quote Marcia Angel, who's the former editor of the New England Journal of Medicine, and she said back in 2009, she says, well, we have to go to single payer. She says, if you want to cut cost and expand the care, you have to go to single payer. If you keep the profit in the system, expanding care, giving people more of what they need and covering more people will cost more. And if you want to cut the costs, you're going to cut back on the care. That's the way a profit-making system works. That's why we have to go to a system where we remove the profit, we publicly fund it, and we make sure that every single person is covered and there are no barriers, that it's free at the point of service, so people get in and get the care that they need. There's some people who tell us, well, I have good coverage, why should I worry about this? I think everybody needs to be worried about it, because this profit-controlled system has become bad for everyone. For instance, even if you have a good insurance plan, now 75% of our physicians are now employees. Many of them are working for private equity or other profit-making entities who put guardrails on what they can prescribe and what they can do. They are not free to practice according to their conscience. That affects everybody. We have another problem. We have many, but these are we're just skimming the surface, folks. This is just a little bit of what's happening. For instance, we have 700 rural hospitals that are on the brink of closing because this for-profit system doesn't sustain the infrastructure that we need to make sure that people get to go to the hospital when they need it. So it's not good for anybody except those that make money from it. And I think that we saw during the pandemic, the results are just awful for our country. We lost more than 1 million people, and that is a rate in comparison to the population that is far higher than comparable countries. And the studies tell us that over 300,000 of those deaths would not have happened had we had a healthcare system that adequately covered all of our people. I mean, that's like World War II that we lost. These are incomparable figures, and we really you can't exaggerate what a failing system that we have and how much we need to be able to change it. So I brought a few slides, and I'm not going to keep you with a whole lot of them, but a few slides. It's just important to see where we are and to get your head around what's happening in our country, and that it doesn't have to be this way. So all of these I got from Physicians for a National Health Program, and they have the sources there if you want to look them up, and you can have the slideshow if you want. This is life expectancy. That's one of the main outcome criteria for judging whether we're doing any good. Look where we are. We're 6 years behind Sweden. And all of these other countries are doing better. Those are comparable countries. Let's see if I can do this. Infant mortality. This is us, the yellow over here. 5.4 deaths in the first year of life per 1,000 live births. And it's way higher than the other countries. The wealthiest country in the world. We can't take care of our babies. Okay, this I wanted you to look at two different things because it's got two different figures in it. One is comparing race and ethnicity, African American and Native American. These are maternal deaths in conjunction with childbirth. And the first column is African American, which is just outrageous. It's higher than the poorest country in the world. Well, I don't know about that, but it's higher than many, many, many other countries. But then there's another point that we should look at, and that is, if you look at white non-Hispanic, it's 12.7 deaths, and that's double Canada. So even the most fortunate people in our country are not doing well in this healthcare system. They have a rate of death in childbirth that's double. This one is really, if we have everybody in the country understood this slide, it would be wonderful and we could get there quicker. because this is the spending, total spending on health care. And this is what total spending these other nations, Japan, UK, France, etc. The US is the whole bottom line, the yellow and the orange together. So the US is spending about $13,000 per person. And these other countries maybe something like half that. So it's not that we're not putting the money into it. The money is there. We're not using it to get the outcomes. Okay, so the people in the health policy gurus in most of academia and lots of places that advise the two mainstream parties say that the reason that our healthcare costs so much is that it's overused. The doctors are prescribing too much and the people are getting too much care, and therefore we have to have these deductibles and co-pays and all of these things to crush down that overuse. That's the problem. That's the way they see it. So the question is that true? Do we get too much care? This is hospital inpatient days per capita. US is down here, Germany 3 times as much, the others all higher. So we're not going to the hospital more. That's not the reason. And are we going to the doctor too much? No, not there either. The US, we get about 4 visits a year. Japan about 12, the others much higher. So there's just a couple of, just so we know what we're saying, because they say they're going to crush down this overuse, and that's how we're going to bring down the costs. And they're totally wrong in what they base it on. The facts are otherwise. Now this is a problem for every worker. This is the deductible. And in 2022, for a single worker, the average deductible, that's how much you have to spend before your insurance even counts for anything, is $1,763, which is more than many millions of workers have in their bank account, which means even in spite of their insurance, they're not getting care. Okay, so that results in the increase in the phenomenon of underinsurance. In 2010, when we were working on getting the Affordable Care Act passed, everybody said the problem is the 48 million people that don't have health care coverage, have no insurance at all. And we're gonna, they set up the exchanges and they expanded Medicaid and they did lots of things because they were gonna cover those people. They covered some. About 28 million now don't have coverage. But the other piece of it is that underinsurance increased. In other words, the people who nominally have an insurance policy but can't afford to use it, or their doctors aren't in network, or they can't get care anyway. And that's what has gone up from 16% to 23%, a quarter of the people. So this other group, you got the insurance, you still can't get the care. Okay, and this is it's just a slide to show that being underinsured or uninsured increases your chances for delayed care and seeking help for a heart attack. And for underinsured and uninsured, it's not too different. It's almost as bad to be uninsured as it is to be underinsured as to be uninsured, because it causes that delay. This is the slide everybody knows. This is the big blue mountain. That indicates the increase in managers' administrative costs, all of which is in the system to do the billing and the profit. The yellow, you probably didn't even see it, but down at the bottom, there's a little yellow line, and that's the increase in physicians. So this is what's happening in our country. The managers are increasing 4,000%, the physicians hardly at all. These are the people who do the care. These are the people who do billing, utilization review, calling to challenge your authorization on your health care. That's the problem. That's what we have to remove in order to be able to have a healthcare system that works. Just a picture of the profit. 117 billion in the pharmaceuticals, insurers, etc. It goes up and up and up, and this is a couple of years behind, so it's even higher than that now. This is the good news. In spite of all of the propaganda that we get, we have majority support for our position. A majority of the people favor, is the yellow line, favor all Americans would get their insurance from a single government plan. So we have the hope that because there's majority support for this, it ought to be something doable in a democracy. And it's something that we're working on, and there's much more work to be done. But we do have the majority support within our country. And let me see, I just had an ending here somewhere. We just can't be too strong on the issue that we have a failing healthcare system. The Commonwealth Fund did a report recently, and they found we were at the bottom of all the comparable nations in terms of outcomes, in terms of equity, in terms of all of the things that are important. And it's led to physician shortages and nursing shortages. We have a system that's very uncomfortable for people who have to work in healthcare and for their ability to work according to their conscience and according to their profession. So we have to work on it. We're 55th in life expectancy. We lose 68,000 people every year needlessly who would not die if we had a healthcare system that worked. And the main principle is that it's the profit. We have to remove the profit motive, remove the for-profit insurance industry, remove the for-profit hospitals. Well, we need the hospitals, just the people who are making the profit have to go away. And because we can't solve it with less than a national single-payer plan, we need to be bold enough to say that we stand on this and that incremental changes, while they may help a few people, they cannot fix the system and really bring care to all of our people. So, thank you. And we have petitions back there. If you sign it, you get on our email list and you'll get our newsletter twice a month. We have bumper stickers, we have brochures, and I'm going to open this up to discussion and questions. Dalton.
So in your leaflet you talk about how labor has a role to play in building the case for universal health care. What, in your experience of both as a unionist and as trying to work with unions, what has been the best way to approach this topic with other unions and specifically the rank and file to be like, hey, we need to build the support for it? Because you said that the leadership was say that they're down for it, but they weren't. So what's the strategies you would give to other organizers on how to convey that information to fellow members of unions?
Wow, that's not easy. I think that we have to keep working from the grassroots to push the union movement. Everything that people experience in their negotiations I don't know if any of you are in negotiations or, have had to bargain for health care. It costs a fortune. And it's very, very difficult to get a raise because you go to the bargaining table and the employer says, we need $5 an hour more to put into health care just to maintain what you have. So there's every reason for every union to be on board with solving this, because it's cutting into our ability to negotiate wages or to do anything else. And I can't tell you exactly what we need to do, but we have to push some more. I think in every country that has a universal health care system, it was the union movement that played a vital role in making that happen. I know there's some folks that always tell me, Kay, you have to organize the employers to be for this, because if they're for it, then we'll win it. And I said they have a reason to want to be for it, because actually employers could pay less in a system of single-payer health care. I'm not persuaded that those are the folks who are going to move anywhere, because their control over health care gives them a big handle of control over workers. So I think that the push has to come from the working class, from ordinary folks, and from as many people as we can organize to put into motion demanding it. And, I'm frustrated by people who say, well, Kay, look at this Congress. And, yeah, I know. Look at this Congress. You can't pass that. So then they suggest that we change the goal to something else. But, the demand has to be equal to the problem. And if we're going to get there, we have to persuade people to stand on it, and we need a sentiment of rising hope and aspiration. And that's what we're working to do, is to raise. It's not good enough to negotiate 10 drugs. It's not good enough to pay $35 a month for diabetes. It's not good enough when 100 million people in this country have medical debt. When you have medical debt, you don't get care, for the most part. I mean, I've known people who wouldn't go to the emergency room because of the money, because they didn't want the bill. They risked their lives not to use their health care insurance because of the money that it costs. So, we have to work on it, Dalton. I'm open to suggestions as to how we win the labor movement to actually take a strong stand for national single-payer health care. Yes?
I read about the Panthers back in the day having free ambulances and other community-oriented healthcare programs. I don't know much about it, but I was curious. There's been a lot of mutual aid networks, especially after COVID's happened, that have facilitated the needs of people like food, housing, things like that. Are there any mutual aid networks that have facilitated anything to be able to combat the extreme cost of healthcare?
Well, there are a lot of people who try. For instance, Garrett Adams back there, he set up a free clinic in East Tennessee so that people could get care who didn't have any insurance. So there are some things, but we can't do it with charity, with just trying to help each other. We have to make the system, the whole system, get on board and take care of us, because there's no other way to be able to do it. I wasn't aware that I don't think that anybody, I think it's good, when people are on strike, they set up efforts to get people care, and to help them out along the way. But it's just a little temporary, getting you across the line. It's not anything that's hopeful for us as a future. We have to have a system that works. And we have to do that legislatively. We've got to pass it through a Congress, and we have to make them do it. Carrie.
Hey, Kay, if you will ride this out with me, the question's gonna come at the end. I'm gonna give you a couple of examples. But like for mental health, we give an example of that when folks are not able to go to the doctor or to get the medication that they need to properly maintain their mental health, we see attrition in the workplace. And then we also maybe are paying for this as it's 6 degrees of separation where people end up in the homeless population, and how much are we paying for that out of our tax dollars. And then 2 more examples, the parent who has a mental health issue who is not able to follow through with either their therapy or their medication because of insurance, and so then they lose their mental health status and they have their children removed. And the children go into state's custody, and then we're once again paying for it with our tax dollars. Or vice versa, the parent's mental health is fine, but the kiddo is not getting the mental health they need, and they're having trouble across environments, and again, the state comes in and removes these children. Or like, so how much are we getting into the mental health community and saying, hey, we need y'all too?
Good.
Question.
Yeah.
Well, we're not doing a good job on mental health in our country. I think worse than we're doing on the others, which is already pretty bad. So your point is really well taken, Carrie. And we have to, that has to be included in the whole thing, to make it work. Yeah, we got to organize everybody. Everybody. Ben.
During the live stream that we had a couple of weeks ago, one of the viewers had asked you a question, but we had already logged you off by then. But he was asking if you had worked any with Ralph Nader, the Green Party, and I guess to broaden that question, what other organizations outside of even labor, have support single payer healthcare and that you all have worked with?
Well, a lot of organizations do. I was on Ralph Nader's radio hour one time, and I don't.
Public Citizen is supportive.
Pardon?
Public Citizen.
Public Citizen
Ally and partner.
is supportive. A number of the religious denominations passed resolutions, and a lot of people worked on the Presbyterians and finally got them on board for national single payer, which wasn't easy because David Jones is a Presbyterian. David Jones is the Humana founder. So there are many organizations that are supportive, and we have a majority of the population, but we don't have the serious kind of push that we need to actually bring it across the finish line, and hopefully we're building that. One thing that was clear in this recent period of time, when the CEO was killed, in the aftermath, there was like this uprising of rage expressed about, denials of care by the insurance industry. So one of the things that we hope to do is to channel the rage into a positive, constructive effort to pass the legislation. There's a group that are now working on a nationwide demonstration to take place May 31 to demand enactment of national single-payer health care.
Okay, maybe you would say another word or two about the legislation that has been in the Congress, for example, Pramila Jayapal's bill and others.
Well, there are, they're not in now because we have a new Congress, so they have to be reintroduced. But in the last Congress, there was a bill in the House that was sponsored by Pramila Jayapal of Washington State. That's a national single-payer bill. And there was a bill in the Senate sponsored by Bernie Sanders. And I think those will be introduced again. I don't know exactly when, but in the new Congress.
So, Kate, 676 was introduced in what year?
2003.
Okay, so since 2003, every single year, there's been a bill
Right.
introduced in Congress. Just some historical background.
Right. I think we had up to 125 co-sponsors in the House on 676, which was Congressman John Conyers' bill, and there are 435 in the House. So. Yes?
I'm curious because a lot of the liberals typically have, talked about Obama as kind of like the pinnacle of the last few decades of the success of liberal institutions in this country. I guess my question is with all the rising healthcare debts that have been going up, all the charts that you've shown us, did Obamacare or did Medicare, the expansion of Medicare, did it do anything for the average person? Did it offset anything at all when those profit margins are increasing and getting worse every year? And B, if you can, this is outside of the wheelhouse of this conversation, but there was a supermajority in some talks that Obama had to be able to push through a much more expansive and aggressive healthcare reform effort. What fell through with that, if you have any insight on it at all?
Well, I go back a long time with all of this. In 2003, Obama was in Illinois, and he made a speech at the Illinois AFL-CIO saying he was for single-payer health care, and that in order to win it, we needed to have a Democratic Congress and a Democratic Senate and House and a Democratic president. And then when he had that, he did not push for single payer. From the time he was president, he was not a proponent of single payer. At one point he said, if we were starting from scratch, I would be working for single payer. But so, there were things. I mean, I have friends. There's a doctor who's a dear friend of mine, and she says, okay, don't put it down. We had so many people got into Medicaid with the Obamacare, and it meant a lot, and, they got their untreated diabetes taken care of, et cetera. It was really, really important. And so it was. I mean, it helped. There were like 20 million people that got insurance under the Obamacare, but it didn't set up a system that is workable. So now we have more people that go without care than we had before. And that's the problem we have to face, is that the exchanges are so expensive. Is anybody in the exchanges? I mean, it's awful. The deductibles in the exchanges are just outrageous. And a lot of people got a break. One of the ways that the Affordable Care Act works is that it subsidizes the purchase of health care in the exchange if you have low income. And during the pandemic, that was extended to a higher level. So a lot more people got subsidies, so they're not paying as much. That will expire this year, unless something happens that they extend those. It means the bottom's going to drop out and people are going to owe like another $500 a month for their health care. And we're going to see millions more people drop out of the insured rolls. So we just don't have a system that works. And, Obama was persuaded by the industry, I think, to go with the plan that they said. And, we see what it did. I know Quentin Young, who's one of the founders of the Physicians for National Health Program, said he would have unequivocally voted against the Affordable Care Act because it's not a system that will work. And we don't want to make the mistake again. You see, we don't want them to come up with another jerry-rigged pro-profit system. We want to go to a system that will actually work. Dalton.
During the live stream we had a few weeks ago, you had made mention of Medicare Advantage and talked about that. Do you mind going back over Medicare Advantage and what that does and how even when you did have some elements of public funding or healthcare in the United States, how private interests try to exploit that?
Yeah. Medicare is the seniors program, publicly funded, comes out of your check. 1.45, you and the employer, comes out of your check, and it pays for the health care for those 65 and over. So it's our best program because it is publicly funded and most people are covered by it. It's inadequate because it doesn't cover everything. It doesn't cover long-term care, lots of things it doesn't cover, lots of co-pays, all kinds of other problems. But the other problem is that they have put into place, beginning earlier, but in 2003, they put into place a privatization of it so that half of the seniors are now insured through something called Medicare Advantage. And it means that there's a deal between a private insurance company and the Medicare program and the person to insure you. And the public fund gives a monthly subsidy to the insurance company, and then the insurance company is responsible for paying for the health care. And they get to keep what they don't spend on health care. So we've set up a dynamic in these Medicare Advantage plans where there's a denial of care in order to up the profits for those companies. And they've now got over half of the seniors in them in the Medicare Advantage because they cost less on a monthly basis. You can get a Medicare Advantage plan with a drug plan, and you don't have to buy a Medigap plan for $0 a month or very little. And if you buy a Medigap plan, a supplementary plan, it can be $250, $300 a month. So people are going into it and risking this because the system is set up to push them into the privatized plan. So we're almost at the point where there's going to be no traditional Medicare at all because it's all going into the public to the private.
You know, it's even worse, Kay. They have over half now Medicare enrollees in Medicare Advantage. The people that enroll in Medicare Advantage are predominantly very low income people or minorities. And by a wide margin, I think I've seen 70 to 80%. So that tells a story right there.
That's a problem. I mean, it's a piece of it, and there's been an effort to expose it. I mean, we've had headlines in the New York Times. Medicare Advantage is a cash cow. They're making billions off of it. And we just got a report from, I think it was by one of those inspectors general, that said those private Medicare Advantage plans are overpaid by $80 billion a year. So that's probably one of the guys that was fired in the recent go-round. But they're just, and that's the biggest money. That's what Humana's whole business is now, Medicare Advantage, because it's such a cash cow and because they can manipulate it so to make the biggest profits are coming in the Medicare Advantage. Ben.
Could you talk a little bit about healthcare workers, whether they be physicians, nurses, and what they have to gain and how they're mobilizing around this issue as well?
There are, that Physicians for a National Health program has about what, Garrett, 25,000 members? Nationally, and they've been the ones since...
When I joined, there were 8,000 in 2008 or 10, 8,000 doctors. And now it's 3 times that.
And Garrett is founder of Physicians for National Health Program in Kentucky, and he's the past president of the national organization. And a pediatrician, he took care of thousands and thousands of children in our community here, so he's a hero. But so physicians have been one of the groups that's promoted it. They're the ones that wrote the physician's proposal for a national health program. And from a physician's point of view, the insurance companies are calling the shots on patient care. They are not free to practice according to their profession and their skills. That's what's happening. Now, some are organizing into unions. There's a big group of thousands in Minnesota at the Alina system, A-L-I-N-A, Alina system, that just organized. And I just saw that in Philadelphia, the residents won a lot of elections and are organizing into unions. So that's happening. Nurses have been organizing and battling. The battle for nurses is that they understaff them like crazy. There's an attempt by the nurses to get control, because that's what I worked on here, this battling to organize the nurses in hospitals. Because one of our nurse leaders, Betty Schmidt, said, even the most excellent nurse can be overworked to the point of incompetence. So it doesn't matter how skilled she is. If she is in charge of too many patients, she can't do the job and can't successfully accomplish it. So healthcare workers have a lot to win with getting a system that's not controlled by profit.
That's like a double-edged sword in a way. Let's say they negotiate great contracts and they get great wage increases and great benefit increases. The insurance company, the privateers, will only raise the rates more to offset them. So that's why that's not a viable.
And we have a takeover of the hospitals more and more by the profit-making industry and private equity that I don't even have all this figured out, but they sell the property and they separate it from the business, and then they rent the property and they make a lot of money with a little venture capital. You had a question?
This one is a little bit more practical. So I'm a part of the IFFA, which is, if not the largest, one of the largest unions in the nation. And I do try to have these kind of critical conversations with my fellow members in the union. However, one of the issues that I come across very often is they are very right-wing MAGA, and a lot of times they refuse to accept facts when presented to them. And so for me, this is very compelling, and I can see the benefit, but how would I practically get my union members, because this would ultimately be a union worker-led movement, how would I be able to get them on our side when they systematically do not listen to facts?
That's the firefighters, by the way, the IFFA. You can have my slideshow.
I would love that, but I have taken literal statistics and stuff in the firehouse and at union meetings, and it is met with hate and disgust.
Have you talked to them on healthcare or?
I've talked to them most recently about not specifically healthcare, but how homelessness and a UBI for homelessness, how that is cheaper than us going out there and ambulances going out there. And they, even with all the stats from Colorado, Denver, Colorado, they did a study a couple of years ago about giving 3 groups of people either one time $500 or $500 monthly or $1,000 monthly, and they found that employment and achieving housing and becoming stable was best when you gave them $1,000 monthly no questions asked, and they can do anything what they want with it. And it ended up saving them a lot of money because the resources from firefighters and the ambulances and just the strain on the medical inside, it ended up being cheaper to just give them $1,000 for them to become stable. And I brought up statistics and I brought up facts and I showed it to my coworkers, and still it was brought up with, yeah, but I don't like it, I hate it, I don't wanna listen to facts. And I get that it's cheaper, and I'm a right-wing conservative, so I wanna do what's cheapest, but also I guess I just hate poor people. So I'm having a hard time trying to sway these people to use facts and information to sway them onto the side of humanity, and it's difficult.
I appreciate that you're working on that. What happens how do they feel about their health care coverage?
It's very odd because especially when the CEO got shot and killed, there was kind of like well, yeah, thank goodness. I mean, he had it coming, but then also, when you try to talk to them about, well, maybe we should do things to help other people and ourselves, they're like, well, why would people in the unions in Starbucks, why do they even need a union? They're low-paid workers. They feel like the only people who need unions and support are firefighters, police, and EMS, and they feel like these rights are only for us and not for everybody.
How much
and
do they
the
pay
system,
for their insurance?
How much do you pay for the insurance?
There is some free insurance that's paid by the, but you can pick different levels, and I picked the mid-tier, and I'm paying about $200 before tax, and my deductible is still about like $2,000.
Well, that could be a starting point to talk to them.
Is that individual family, 200?
That's for individual. The family goes up a little bit more, but I'm not sure what that number is.
Did they get a contract this year from the city?
They did get a contract this year.
But they didn't get what they wanted. I mean,
Oh, we were up in arms, but it was, Mayor Greenberg started to kind of threaten our union and say, I've been trying to be nice to you guys, and then you vote the contract down, and then also, I feel
Why'd they vote
like
the
people in
contract?
our union are
why
not,
did they vote the contract down? Not enough money?
it was primarily pay.
Well, there's the point, you're paying for healthcare, and you can't get it in the raise.
Mhm.
You can't get wages because you're paying for healthcare. I mean, at some point, we've got to see that.
If you could connect to their own self-interest in it, that really is, I know it's not easy, although I suspect that the shine's going to wear off when Trump doesn't lower the inflation rate. But I would, I would talk to people on the basis of their own particular needs. I sat down in the city council chambers with the firefighters many a time because of the low wages. We were all down there battling it because firefighters aren't paid that much, right?
Sorry,
No, not as much as we should be, but
they
that's
all have
everybody.
mothers and fathers that are on Medicare
Mhm.
that don't go through this, and a lot of them are veterans, so they're covered by the VA.
Mhm.
That's a system that is a no-pay system.
But if there's anything I can do to help, I will. I mean, I'd be glad to come talk if they want to. Or you can talk. You can take the slideshow and talk. Take the flyer, because there are points about, why workers have everything to gain by it. Mm-hmm. And good luck.
Thank you. To somewhat jump off that, I have a question of, first I'll explain the situation. So obviously in rural America, the healthcare is almost non-existent. Hospital closures are happening at an alarming rate. And so my question is, when it comes to, single parent universal healthcare, what role either has, people who live in rural parts of the country have played in universal healthcare, and if they haven't had much of a role, what role do they play in like building up, support for this movement?
I don't know. I think that, that's really is one of the things that we need to figure out how to do, and that is to get an uprising among these rural areas for health care, because they really are hurting in terms of their ability to get care, and it's fast disappearing. We have a little experience. Lane and Garrett and I went to Vico. You know where Vico is? Vico is in Floyd County. It stands for the Virginia Iron, Coal, and Coke Company. It's an old coal town. And we got the county commissioners, the city commissioners in Vico to pass a resolution in favor of single-payer health care. So, I believe that they can be reached in rural areas, and it would be something if we could do that. I mean, if we could use this issue as a way to mobilize people in rural Kentucky for positive things, it would be a wondrous thing, and I'm eager to find the ways to to make that happen.
What was the main struggle of convincing, or was there any struggle in convincing them?
No, I called Vico had passed an ordinance forbidding discrimination against LGBTQ people. So I thought, let me call this mayor and talk to him about health care. And his name is Johnny Cummings? I think that was it. I called him up and said, I want to talk to you about this. He says, well, send it to me. I said, well, we want you to pass a resolution. And they did. So, sometimes you can connect on that. We don't have enough people organizing this everywhere and thinking and working. And, we need fires, springing up everywhere with the demand, because the demand has to be intense if we're going to change things around. So,
Kay, you've had a lot of experience with the labor union, with the labor movement, and know about how the various unions have supported single payer and have passed resolutions in their meetings and as a unit. What is the germ of let's do it about single payer that the unions could apply to the firefighters? What this young man here who wants to light a fire among what is it? What's the difference between how did it happen? And name a union where it's happened, and why wouldn't it happen in his? What's the difference? How can it happen?
Well, maybe it can, Maybe it can. I would be happy to, there's a link, I think, in the flyer. Is there a website on the back of that?
There is Unions for Single Payer.
Right. The list of 600 unions that endorsed National Single Payer Healthcare is linked in that link.
You show that to your friends.
And,
And get some of those leaders to come to your meeting and say, this is what we did, and this is why we did it.
Mm-hmm.
Because they're there. I know they're there, and she knows them. And they're very strong. I mean, we're not going to ever get national single-payer health care without full support from labor.
And one of the things that we had to take on the idea that everybody's backward, and it wasn't true. It was the plumbers and pipe fitters that were among the first to pass a resolution at the national level. We had a guy in Savannah, Georgia, and a guy in California. One was very progressive, one was whatever. And they worked on getting that resolution passed amongst plumbers and pipe fitters. We got the building trades in many areas to pass it. Because all of those unions, even though we think of the craft unions as they're not with us on anything. But on health care, their plan went under. They had the plumbers and pipe fitters here in Louisville had a joint plan with the employer, and it went broke. And they had to, they lost their plan, and they had to go to Humana to get their insurance. So everybody's got the problem of how do you do it? And, if we can connect with people we could be out from under this terrible expense and actually have health care. Dalton, and then Ben?
So, we were on the Starbucks picket line a few weeks ago, and you were talking to some of the workers there. And I think I mentioned you talk about healthcare with them. What's the general temperature of younger people when it comes to the topic of healthcare, and especially when it comes to single-payer healthcare? Are they in favor of it? Are they still focused on we're trying to get it with our, say, unions rather than nationally? What's their opinion on it?
Well, I think that all the young people are for it. I don't think that there's any question. We have a majority of people. I spoke to Tamara Bell, I think, is the leader in that Starbucks union. And I asked her, I interviewed her, and I asked her, I said, what would it mean for your struggle to get a contract if we had national single-payer coverage and people were automatically covered? She said, it would be wonderful. We wouldn't have to try to bargain that at the table. So, yeah. Ben?
The online discourse since the CEO's killing obviously has been just kind of all over the place. Pro and good and bad. I guess good in that it is a temperature gauge to show I've seen people that I would consider pretty far right, saying that like Austin had said, that he got what he deserved. And so that does show that there's even people on the right that are in agreement on this issue. But the discourse that I've been seeing for the most part is just anger, frustration, a desire for more violence. Obviously, I'm sure that Kentuckians for single-payer healthcare are on the same page as the brigade. We don't believe that we're going to be able to shoot our way into single-payer healthcare. So what is the answer then? We talk about getting organized. How do you see this campaign growing and finally tipping the scales?
Well, I think winning more people and winning people to a higher level of demand and activism, and not leaving the question behind, and forgetting about the idea that we can get there incrementally. That somehow if we win one little thing and then another little thing, and it doesn't get us there. We have to take the profit out of the healthcare system. You need national legislation to do that. So, and many people don't know that. So they just work for one thing and another. So that's why it's important to have a basic knowledge that we have enough money in the system. we have enough money to pay, and you will pay less when you get there. So we have to stay at it and raise the level of demand. Sometimes I'm surprised that people look at it and say, "Oh, it's really bad," and then there's no demand that it change. And I think we have to give people hope that if we are active and if we do these things and if we bring more people into this battle and if we insist to our legislators and if we unelect the ones that won't go with us, that we have the ability to do it. I was active in the civil rights movement, and people didn't ask, was it possible? People said it had to be done. So, they faced whatever they had to face in order to do that, because it was the right thing. So I think we need a movement in the country that won't take no for an answer.
So, Kay, isn't it what you're trying to say, really, I think, is that we need a lot more people like this young man right here.
Yeah.
That's going to just engage his fellow employees in conversations, his neighbors, talk to people. That's what it's all going to have to be about, people talking to other people. I talk to people until they either walk away from me or tell me she can testify.
Well, you're all welcome to be a part of it. If you sign the petition over there, we'll put you on the list and we'll be able to stay in touch with you if we have your email.
So I think one thing I've seen a lot of people talk about is the need for a third party. I don't necessarily myself expound that belief necessarily myself. I think a lot of people, specifically after Kamala Harris's campaign and the defeat, crushing defeat, because there's more absentee people and there were people that voted. There's a lot of cynicism right now about the Democratic Party, about legislative change. That's something we've talked about here amongst, comrades and things like that. That's why I was brought up mutual aid as an example. How do we hold the feet to the fire of politicians when we had this majority, Obama, and we had the power and we had some of the will there, and then they turned on us. How do we do that, and how do we do that in this climate when there is such cynicism towards electoral politics to the point where people won't engage in it?
Political independence would help. It would certainly help if there were independent parties pushing. There's no question about that. It's very difficult. They're iced out of the political system in many ways. It's very difficult to get on the ballot. But hey, in 1968, I petitioned to try to get Dr. King and Spock on the ballot in order to have a peace and freedom party. So I'm for it. I think we have to push, and that's one of the reasons why this two-party control over the system is not helpful. So if people want to work on it, that's something people could work on, in my opinion. I'm not speaking for Kentuckians for single-payer health care on that. I don't know their position on it. Thank you.
Thank you, Kay Tillow, for the information you've shared with us and the solidified importance of universal health care. And thank you, everyone here who's stayed to listen. Healthcare being one of the most basic and most universal needs of almost everyone means it's a commonality that we all share and is something that we should all have easy access to. This profit-driven system has not only derailed the accessibility of our healthcare, but the existence to it as a shared need. Separating how sick someone can be based on premiums someone can afford without care, and without care for how it affects our communities, our family, and ourselves. Where the system of other countries may not be perfect, there are way closer and equitable systems than we hold right now, and we hopefully can fight for this all. If you'd like to hear more from Kay Tillow and others on U.S. healthcare, we at the Louisville Workers Brigade and Revolution Kentucky, we recorded a live stream where Kay Tillow and others talked about their knowledge and experience with the U.S. healthcare system. This was part of an effort by the Brigade and Revolution Kentucky that we are doing to teach and educate people about the U.S. healthcare and ways we can improve our healthcare system. Along with this joint campaign, we are hosting Walter Tillow next month on the 18th at the Northeast Regional Library, where he's going to talk about his involvement with the Student Nonviolent Coordination Committee. If you'd like to support our campaign or the brigade itself in our effort to unite and build together the working people, please either talk to me, Dalton, Benjamin, or anyone at the table afterwards, and we can see what we can have you help us with or what we can help you all with. You can also follow us on Instagram and Facebook, or check out our website at louworkerbrigade.org, where we post our educationals, articles, and events. You can also find our previous educationals on our YouTube. Links for that, for those who are interested, is also at the table, or you can ask me, Dalton, and Benjamin. Thank you all for coming once again and learning. We are the Louisville Workers Brigade. We are here to educate, support, and unite the working class.
This union maid was wise to the tricks of company spies. She couldn't be fooled by a company stool. She'd always organize the guys. She'd always get her way. When she struck for better pay, she'd show her card to the National Guard, and this is what she'd say. Oh, you can't scare me. I'm sticking to the union. I'm sticking to the union. I'm sticking to the union.